All right, today we're diving into a medical emergency where literally every single second counts: cardiogenic shock. We're going to break down what happens when the body's most important pump fails, how that failure creates this deadly downward spiral, and how clinicians race against the clock to stop it. Let's get right into it. So let's start with that big question. What actually happens when the body's most critical pump, the heart, fails? Well, you can think of your heart as the engine in a really complex, high-performance machine. If that engine suddenly loses power, the whole system just grinds to a halt. Your vital organs get starved of oxygen, and this terrible cascade of failures begins. That right there is the core of cardiogenic shock.
So how do we officially define this catastrophic pump failure? Let's take a look at the specific clinical criteria that tell a doctor, okay, this is what we're dealing with.
At its heart, no pun intended, cardiogenic shock is a state of what we call hypoperfusion. It just means the heart is failing as a pump, and that's causing dangerously low blood flow to all the vital organs. Now, clinically, it's defined by this specific trio of signs. First up, you've got persistent low blood pressure. That's the most obvious sign the pump isn't pushing hard enough. Second, a reduced cardiac index. Think of this like the engine's horsepower. It's just not generating enough power for the body's needs. And third, you have elevated pressure in the heart's filling chambers. This tells us there's a literal traffic jam of blood that the weakened heart just can't move forward.
So, what can actually trigger a failure this bad? Imagine the heart is a house with 4 rooms and 4 doors. Well, by far the most common cause is a massive heart attack, which is like a fire starting in the main engine room, the left ventricle. But, it's not the only way. You can also have problems with the doors, the valves, not closing right, or you could even get a hole blown in the wall between the rooms. As you can see from this data, any one of these major structural problems can bring the whole system crashing down.
But here's the thing. The initial injury is just where the trouble starts. The real, terrifying danger of cardiogenic shock is in this self-perpetuating cycle. It's often called the vicious spiral because the problem literally feeds on itself, getting worse and worse. Let's walk through this deadly spiral step by step. It all starts with an injury, usually a heart attack, that weakens the heart muscle. Okay, so now the heart can't pump as hard. That means less blood gets out and blood pressure plummets. But here is the truly cruel twist. The heart's own arteries, the ones that feed it oxygen, they rely on that same blood pressure. So as the blood pressure drops, the heart starts to starve itself of oxygen. This makes it even weaker and less able to pump, which, of course, makes the blood pressure drop even more. You can see how this becomes a terrifying, accelerating cycle of destruction. And if that wasn't bad enough, the body's own attempts to save itself often backfire spectacularly. You'd think the body would try to help, right? Well, it does, but its help actually makes everything worse. Imagine trying to push a car that has a really weak engine. The body's response is to squeeze all the blood vessels to try and force the blood pressure up. That's like having someone stand in front of the car and push back even harder. It just adds more strain to the failing engine. At the same time, the body holds onto fluid, which is like pouring water into that engine, causing it to flood the lungs. It's just a perfect storm. Okay, so that's the absolute chaos that's happening on the inside. But what does it look like on the outside? Let's put on our detective hats. How does this downward spiral actually show up in a patient at the bedside? This is one of the classic telltale signs. In a desperate move to survive, the body makes a really tough choice. It sacrifices the arms and legs to save the core organs, like the brain and, well, the heart. Blood flow gets diverted away from the hands and feet. And the result? Cold, clammy skin. It's a hallmark sign of this systemic hypoperfusion. Now, this one is maybe the most alarming sign of all. The brain is the body's command center, and it is incredibly sensitive to a lack of oxygen. So when a patient starts getting confused or agitated or really sluggish, it's like a blaring red alarm going off. It tells you the command center is under attack and the crisis has reached a critical stage. Time is running out. And of course, there are other key clues we're looking for. The heart starts beating faster and faster. That's tachycardia, in a frantic attempt to make up for its weakness. You see shortness of breath or dyspnea as a fluid backs up into the lungs. The kidneys, starved for blood, pretty much shut down and stop making urine. And the pulse pressure, that's the difference between the top and bottom blood pressure numbers, it gets really narrow, another classic sign that the pump is failing. With that clock ticking away, just suspecting it isn't enough. We need definitive proof, and we need it like yesterday. So what are the essential tests we use to confirm the diagnosis? These are the first tools we grab from the toolbox.
An ECG gives us an instant picture of the heart's electrical activity. It can tell us right away if a heart attack is the culprit. A bedside ultrasound, an echocardiogram, is basically like having X-ray vision. We can literally see the heart struggling to pump and check for any structural damage. And then you have the blood tests. A high lactate level in particular gives us the chemical proof that the body's tissues are suffocating from a lack of oxygen.
So, while all those clinical signs point us in the right direction, these are the hard numbers that really lock in the diagnosis. They give us a precise, objective measurement of the pump's failure. A low systolic blood pressure confirms there's no forward flow. A low cardiac index quantifies just how weak that engine is. And a high wedge pressure tells us exactly how bad that traffic jam of blood is behind the failing pump. These numbers give us a real-time assessment of just how bad the crisis is.
You know, to make sure everyone is speaking the same language about how severe the shock is, experts came up with this staging system. Honestly, the best way to think about it is like a hurricane scale for the heart. Stage A is like a tropical depression. The patient is at risk, but not in shock yet. By stage C, you've got a full-blown hurricane that requires immediate aggressive intervention. And stage E, that's a catastrophic Category 5 storm with complete circulatory collapse. This system gets the entire medical team on the exact same page about the storm they're facing.
So, how do we fight back? With the patient spiraling down, the single most important goal is to break that cycle. Here's how it's done.
Managing cardiogenic shock is really like launching a coordinated, multi-pronged counterattack, all at once. First, you have to secure the airway and support their breathing with oxygen. Then, you carefully manage fluids, and it's a real tightrope walk. You don't want to give too much or too little. Next, you bring in the heavy artillery, powerful IV medications to support blood pressure. And finally, and most importantly, you go after the root cause, which very often means an emergency trip to the cardiac cath lab to open up a blocked artery. Now, these life-saving drugs, they work in two very different ways. You've got vasopressors, like norepinephrine. These are like tightening a loose garden hose to increase the water pressure. They squeeze blood vessels to raise blood pressure. Then you have inotropes, like dobutamine. These are like giving the pump a direct jolt of electricity. They make the heart muscle itself squeeze harder. Very often, you need a really delicate balance of both to get the system back online.
When the drugs just aren't cutting it, we have to call in the machines. These mechanical circulatory support devices are basically life rafts for a drowning heart. They can temporarily take over the job of pumping blood, which gives the heart a desperately needed chance to rest and recover. But, and this is a huge but, it's crucial to remember that these machines are not a cure. They are a bridge to somewhere else, either a bridge to recovery or a bridge to a more permanent fix, like a heart transplant.
So after all of that, after all this incredible technology and these powerful medications, we have to face a really sobering reality. This number represents the in-hospital mortality rate. That means that even with the absolute best care available, up to 60% of patients might not survive. It's just a stark, humbling reminder of the incredible power of the human heart and the absolutely devastating consequences when it fails.
And that brings us to our final and most important question. We've seen how cardiogenic shock creates this vicious spiral of destruction. The challenge for everyone in medicine and critical care is to figure out how to transform that spiral. With earlier recognition, better teamwork, and even more advanced technology, can we actually turn that downward spiral into an upward spiral of recovery? The lives of countless patients really do depend on the answer.